This is Dr. Hertzberg from Balanced Flow Wellness. I wanted to thank you so much for downloading and listening to this presentation. It's super cool what you're about to embark on. And as you know, this quick video is kind of a prerequisite for your initial consultation. And the reason why is I want you to kind of know what the program that you're about to embark on is about, how it came to be, and how we can help you, right? So thank you again for being our patient, our fan. Let's go. I want you to know that this whole presentation and really the reason why we exist is about you. You hopefully have noticed that everyone on the team knows you and cares about you deeply. Whenever a new client or patient comes in, we try to dig out kind of what is the why behind why you are here. So it's never just the back pain or the neck pain or, I want to change my diet. There's always this underlying cause and kind of a bigger issue at hand, right? So my job as your provider and the team's job is to really figure it out so we can best assist you and help you. And this is kind of why we started doing all of our programs as well. We expanded beyond just being a physical therapy place, and now we are more of an all-encompassing clinic that deals with optimizing your health, optimizing your looks and performance, right? So it's all about you. Unfortunately, I'm from Europe, but unfortunately in the United States, we don't really care about preventative medicine so much, right? Our medical system is really amazing when it comes to acute care. If you have an accident today, if something terrible happens, there's really no better place in the world to be rather than America. But when it comes to preventing disease, so your genetics, epigenetics, we're just not so great at it. And this is directly taken from the Medicare Journal. Care that seeks to prevent disease, promote health, and prolong and enhance the quality of life is not considered medically necessary. Which is a shame, especially now after COVID. We all know that people who were healthy, who had healthy lifestyles, probably coped with the disease process if they got sick much better than the ones who didn't. So this is a really kind of scary but real chart that shows kind of what is covered by insurance, right, and what isn't. So you see here on the bottom, this is the merely surviving. Whenever you come in for a consultation, whether to see me, another doctor here, or just anywhere really, in the United States, we will always ask you about something called ADLs, activities of daily living. And what are those? Are you able to, put your shoes on? Are you able to sit on the toilet, right? Can you take care of yourself? If the answer is yes, unfortunately, Medicare and insurance companies are guided by Medicare bylaws, is not going to cover your care. If the answer is no, then we can talk, and that's when the insurance will actually cover the expenses. So we for years were just kind of doing this, but we've noticed a lot of our patients wanted something more, not just to prevent, but really enhance. And this is when all of the other services that we now have to offer came in place. What we really love doing is helping anyone. May it be someone who truly does need that physical therapy because, they sprained their ankle, right? Their back hurts, they had a surgery. But also people like you who wants preventative medicine, or you're maybe on the cusp of something not so great, and you're wondering, can I stop that? Can I reverse that? Can I get better? So it's that second portion that you can see here, the thriving, which is healthcare, optimizing health, preventative care, proactive care. And that's what we're very good at. Unfortunately, none of those services are covered by insurance. This is kind of a funny slide, but we all know that health doesn't come in a bottle, right? There's no quick fixes. You have to do work. Hopefully it's really fun work, and with us it is really fun work. But here was an advertisement for POM. You may remember, it's still out there, where you can buy it and it will do so many amazing things. It will treat heart disease, prostate cancer, erectile dysfunction. Who wouldn't want that? Does it really though? Does it really? We know it doesn't. Those are some fake claims, and we all fall into this category when you're like on Instagram, right, searching through things. it's not that simple. You have to put in some work, and you have to work with a team of people who get you and understand you and can actually understand the disease process very well and cater the care specifically to you and your needs. So here you can see, is the dog getting walked? The dog is getting walked, but the person walking the dog is really not doing anything. And that's not how it should work, but unfortunately many times this is how our medical system does operate. What we want from you is to be proactive. You have, a few pictures here of celebrities. Obviously, The Rock on one side, who was young and buff, and you have a lot of those examples. And here he is more mature, but still in phenomenal shape, and he eats well, takes care of himself, exercises, right? Here on the other side, you have a wonderful gentleman known as the juicer, the juice guy, who for years was also a bodybuilder, super athletic. His claim to fame is that he started living very healthy life when he turned like 18 and then 20, and he did pass away, but he lived a very fruitful, wonderful, healthy life. So that could be you, that could be me, it should be me or you. We can't cheat death or destiny, but we can for sure live as healthy life as possible, as optimal life as possible. So our credo here is tell me and I may remember. Show me and I will remember. Involve me and I will understand. So everything that we offer here in the clinic at Balanced Flow, we could just show you how to do it or tell you what to do, but is this really a long-term solution? And the answer is no. So we include you, involve you in everything that you do here, teach you about your life, your health, so that you can take those lessons outside of this clinic and sustain that optimal health. At Balanced Flow, we came up with ultimately 5 pillars of health, and these are as follows: nutrition, fitness, mind, body, hormones, and mentoring. And those are the services that we started adding a few years ago and kind of continue on expanding. We created a special program that will encompass all 5, or for some of you, after we meet and discuss your specific case and your why, we can decide, Mrs. Smith only needs that fitness component and maybe some nutrition. And Mr. Jones might only need some help with his hormones, right? But we will figure it out together. Now, a lot of the questions are, is this covered by insurance? And I think you already know the answer to it. It's not. Some things that we do are, but as far as our programming is concerned, it does not, because we are dealing with optimizing your health and performance, not sustaining, right, what is there, or managing a disease. This is not what we do, okay? So this is the best of you. Now, a few little things. There are those 5 pillars, and one of the huge ones for us is nutrition. So we are working with a wonderful company, and we've created a program that's specially designed for your individual needs. We will sign you up for anywhere between 30, 60 to a 6-month program that is going to teach you not only, how to eat and what's best for your body, but will also encompass things like meditation and mindfulness, abdominal breathing, and healthy ways to exercise and do things. And it's really phenomenal. If I can leave you with anything right now, something that really resonated with me was adding 2 servings of vegetables for breakfast, lunch, and dinner, or with breakfast, lunch, and dinner. And I still do it to this day. And it really helped me tremendously. Another component here is obviously fitness. We're huge on fitness. We're movement doctors, right? But here in the office, we realized that maybe you don't have as much time anymore, or maybe you just want to optimize your health and performance, right? Isn't that what this talk is about? So we have equipment such as Miha Body Tech that will squeeze in 2.5 hours of high intensity interval training into one 20-minute session with really phenomenal outcomes. We were just on the news. We are going to be published in Wall Street Journal, maybe by the time you're listening to this talk, we already have, which is really cool. So there's so many amazing benefits, and we're really proud and excited to be working with Miha Body Tech to really make a lasting change in our patients' and clients' lives. We also have something called M-Sculpt Neo, and that is the only technology that currently exists that can burn 30% of your subcutaneous fat, 18% of your visceral fat, which is the really important one that's responsible for your health outcomes, as well as increase muscle mass by 25%. So burn fat by 30%, burn that stubborn fat by 18, that's visceral, and then 25% increase in muscle mass, and it's functional muscle mass as well. And all of this in just 4 treatments, 1 time a week for 30 minutes. Pretty amazing, right? I didn't even touch upon hormones here, but that's a huge other issue as well that we might have discussed with you here in the clinic already. But we do bioidentical hormone optimization, where we look at your labs and then determine whether you could benefit from hormone optimization. And if it is not for you, we move it aside. If it is, we kind of go with this, right? Know that our programs, if it's all-encompassing program, it is going to be in the bulk of starts about $3,000-$4,000 and can end as high as 8 to 10. If you're taking just those individual little smidgens of things for M-Sculpt Neo or for Miha, it starts at $275 a month, and then it goes up, right? So there's really something for everyone, and we will work with your budget, we will work with your finances, but it's important for me to know that when you're entering this kind of sphere of health optimization, you do understand that those are cash services, and we will discuss the pricing when the time comes. Now, why is this so super exciting? I get to work with people. I love my job. I see the change in them every single day, and I get to celebrate with them. I get to struggle with them sometimes, and it's really awesome. And if you can be a part of that, of this like grander, happier, more optimized life, I'm in for the game, and hopefully you are too. So this is our wonderful team and some of the patients and clients that we've had a chance to work with. Now know that I always say that if not you, who? If not now, when? Now is really the time to change. And all I ask of you is to want to change, to have that like special meaning behind why you want to do what you're doing, and then allow me and my team to coach you and guide you, because your interest is my interest. I want what's best for you. It makes you look good, it makes me look good, and it makes my job so much more fun, fruitful, and wonderful. I'm looking forward to seeing you during your evaluation. And if you have any questions, feel free to shoot a message to one of our team members. Thank you so much. Enjoy the day.